Betty. I'm glad to be here. Yes, I have been a licensed counselor for 23 years and have worked with Vista for 23 years. So lots of, and I think I've worked specifically for emergency work for 15 years, just crisis work. Go ahead into the next slide. So what I wanted to talk about today is what the involuntary process looks like. So if you feel like you need to petition someone because you feel like they need to go to Eastern State Hospital or a psych hospital and they're unwilling, but you're worried about their safety. The other is, what are the alternatives to hospitalization? The community mental health centers is kind of the stopgap, it's the safety net, so we can avoid hospitalization if at all possible. And then what to do for tips and tricks for positive interaction when someone is struggling with a behavioral health crisis. So talking about the involuntary evaluation process. So if you petition one of your patients for an involuntary evaluation, the local community mental health center, we're the gatekeepers and we are the ones that provide that evaluation. And to do a petition, the patient has to meet two criteria. One, they have to have a mental illness or their crisis is due to a mental health issue. And the second one is that they present a danger to themselves or others, their family, due to that mental health issue. This could be suicide, but this could also be due to some type of psychosis because of schizophrenia, bipolar disorder, being manic and not being real safe. I've seen people that we've evaluated and admitted because they have a delusion that water is going to harm them in some way, that there are microbes in there. The CIA has put something in there because the government is trying to control them, and they stop drinking all fluids. Well, if you stop drinking all fluids for long enough, you're at risk for dying. So that is another, it's not just suicide. There are other ways that you can be a danger to yourselves or others because of serious mental illness. All of the criteria to be admitted to the hospital, and this is involuntary, this is someone going to be admitted to Eastern State Hospital or another state psychiatric hospital against their will, is, like I said, they have to have the first two, but they also have to reasonably benefit from treatment. And it has to be the least restrictive mode of treatment. So for instance, if someone is having psychosis because of substance use, it's not due to mental illness, and they're not going to benefit from treatment from a psychiatric hospital. That doesn't mean that they don't need treatment. That's just not the place that they need to be. They may need to detox and be put in a rehab or some type of substance use. So all those criteria have to be met. And when we say least restrictive mode of treatment, they could meet all of the first three criteria, but they could be willing to go to the hospital. And if they're willing to go voluntarily to a hospital, I would encourage other alternatives, and I'm thinking of in the central Kentucky region, or even out towards Louisville, like Our Lady of Peace, Bourbon Hospital, Ridge Behavioral Health. If you're voluntarily able to go, that's considered a less restrictive mode of treatment because you're not being held against your will. Next slide. So we also talked about trying to avoid hospitalization and what are the alternatives. And this is where the Community Mental Health Center comes in. And New Vista is one of the community mental health centers. And we offer most of these, and I'm including some others because I know not everybody is from the central Kentucky region that may be here. So we have our 1-800-928, oh, there's a typo. That should have been 928-8000. So before those last three zeros, there should be an 8. And that's our helpline. You can also call 988. And that is answered locally. So it is based on area code. I think the only tricky thing about that is if you have, like I'm thinking of my mother who is from Pennsylvania and moved down here to be closer to us. She kept her Pennsylvania number. So if she were to call 988, someone in Pennsylvania would answer, but they would route it to Kentucky very quickly. We also have a mobile crisis team that operates 24/7. We have something called our critical evaluation team. That's the team that does those involuntary evaluations. They also help our helpline on call if we need to speak to a therapist on call. All community mental health centers have outpatient walk-in emergency, so you can go to your local community mental health center outpatient and say, I'm in crisis, I need help. Some parts of the state, some community mental health centers have crisis stabilization units, and that's a CSU. Again, it's that in between. You need a little bit more than an outpatient, but you don't necessarily need to be admitted to a psychiatric hospital. You need something kind of in between. Those are usually voluntary. And I sent a list that I think Katie is going to put on the resource page, all the CSUs in the state. And it doesn't have to, you may be from a neighboring county. It doesn't have to be a CSU in your county. You, just like hospital systems, you can refer outside your county. And then here at New Vista, our future planning, hopefully this year, that we are going to offer a behavioral health urgent care, which is going to be extended hours. We're looking, once we're staffed up, between like 10 a.m. and 8 p.m. Weekdays, and we're going to see what the need is. And I do know that some of the options that are being developed here in the state, Louisville had this for a brief time. There were some issues with funding, but in our country, we're looking at the 23-hour bed. Because if you look at mental health crises, sometimes you just need just a break. You don't need to be admitted to a hospital or a CSU. You just need a minute to de-escalate and have the supports there. Next slide. So here's a map of our community mental health centers and our state psychiatric hospitals and where they're at, where they're located. I know that this is kind of hard to see, so I included a link in this slide. You can get to that and adjust, and there's also lots of resources with the Department of Behavioral Health about our community mental health centers and our intellectual and developmental disabilities. And positive interactions. One, validate their thoughts and feelings. Even though you may have a different perspective of what's happening or their reality is altered, what they are experiencing is real. That person who is having thoughts of that their water is contaminated, even though we know it may not be true, it's real to them. Be patient, create time and space. It is gonna take, this may take a little bit extra time than your usual patient. And also do one thing at a time, say one thing at a time so they can process that. Next slide. And then here's just some active listening skills about paraphrasing, reflecting, open-ended questions, doing minimal encouragers, also your body language, things like that. Go ahead, next slide. And here's some examples of how I talk about how to be the feelings translator, right? When they say things like, nobody in this place understands me, nobody is listening, you're not listening to me. How do you take that instead of going, yes, I am, and coming across as defensive of, so this is what you're feeling. You feel like you're not being heard. You're feeling like we're not helping the way you want. Let's kind of regroup and figure out how we can meet you where you're at. Next slide. Here's some common myths. Basically, just because someone's suicidal doesn't necessarily mean that they need to go to the hospital. Just because they're at the hospital doesn't necessarily mean we can force medication. And let's see. And asking about suicide is not going to trigger them to be suicidal. One of the powerful things that I want to share is if they're coming to you in crisis, even though that can be anxiety producing, they're in front of you, and that means you can help and you can reach out to people who can support you. Next slide. And this is just how to contact us. These are the counties that we cover at New Vista. And then I also, next slide, I want to talk about our My Strengths app. That's free to everybody, and it has the code See the Good. And I also wanted to share, Lindsay talked about Stanley Brown, which is wonderful. They also have an app for safety planning too. So use your electronic devices and your patient's electronic devices if they have them. It can be powerful tools. Thanks.